The UK government is planning to make the health and care worker visa route more difficult and challenging so that many other healthcare professionals from other countries will find it even harder to come into the UK. Now, as you know, the health and the care worker visa is one of the easiest visas for you to come and live in the UK if you are a healthcare professional, and there are several reasons why I recommend this visa. However, as per the new UK standards and discussions that have been going on in the UK, there are going to be several changes that might impact everyone who is on the health and care worker visa and who might potentially even come on this visa. Some of the MPs within the UK government are trying to make the whole process of the health and care worker visa progressively harder for overseas candidates to come and work in the UK as healthcare professionals. However, there are some other UK MPs who are even just trying to cancel the health and care worker visa altogether. In today's video, I will be discussing some of these proposed changes and why is it that the UK MPs are thinking about it and what is it that's going to impact you in the next few months. So if you want to know more about this, do not forget to watch this video all the way to the end. First things first, like you can see on your screen right there has been this article that has been released which says call for rethink as care worker visas now make up 2/3 of those in health and care scheme. So as you can see right there through the article, there have been several comments that have been made. But just from what you can see right there, out of the 1,89,000 visas being issued, nearly about half of them are being issued to non-healthcare professionals such as your regular sort of carers, which is about 69,120. Now from that article, what later they go on to say is that the Tory MP Jonathan Gillis told Sky News that we have called for a closure of this route because there are over 30,000 BTech students in health and social care and over a million unemployed and about 700,000 on sickness benefits that are keen to get back to work. They also think that one of the reasons they want to close the health and care worker scheme is because they believe that you can train people in this sector on the job and it's up to the business to invest, be it in wages, to improve the terms and conditions, or to make the industry more active. However, there are some other people who believe that obviously once they stop the overseas recruitment for any healthcare professional in the UK, the NHS is going to fall into more trouble, and therefore there are contrasting opinions about this at the minute, which I will share in this video. But let's come to one of the first changes that they've proposed. So the first massive change that they've proposed is that obviously for you to be able to come into the UK as a skilled worker or a health and care worker, you need to have a certain minimum salary threshold. Right now for health and care workers, this minimum salary threshold is at £25,600, but they are hoping that this would go up to £30,000. Now let me inform you, if you are somebody on a band 5 salary level, you will not meet this threshold, say if this were to be implemented in the next month. So obviously this is going to place massive restrictions on you if you are planning to come into the UK as a band 5 or even below. Second recommendation that they have for all healthcare professionals is that they would want all of the overseas healthcare professionals to have nearly 2 years of experience in a relevant field. So what does that mean? What it simply says is that, for example, if I'm a physiotherapist, they would like me to have 2 years of experience back in my home country before I come into the UK to work. And this is again because they feel that many people who are not related to healthcare professionals are applying for this visa and taking advantage of this visa route. Now, if you believe that I'm joking about people taking advantage of this visa route, please check out this video where I've highlighted some of the UK Home Office employees themselves complaining about this in the past. The next massive rule is that they are hoping that the UK health and care worker visa will be reduced from its overall duration of up to 3 years to only 2 years. So that means that you will be granted a visa to live and work in the UK as a healthcare professional for only 2 years from now on. Another rule that they think is going to be helpful for this visa and is something that we need to be concerned about is that they believe that they do not want any of the dependents to come into the UK on the health and care worker visa. So earlier there were talks about how they would not want people who are maybe coming on carer visa alone. However, now there has been discussion that even people on the health and care worker visa will not be allowed to get their dependents, that is their spouses and their children, with them. And like I said before, the next thing is possibly that some of the UK MPs are actually saying that they don't need the health and care worker visa altogether. So they are hoping to scrap this visa category in the next few months. According to these people, they believe that the UK doesn't need any more overseas or international healthcare recruitment because they believe that the UK itself has enough number of employees within the health and social care sector. So some of the MPs on the other side of the argument are saying that if they stop overseas recruitment or international recruitment, it is going to mean that the NHS is going to have even more poor quality of care being offered to all of the people in the UK. And it will become progressively harder for the NHS to recruit healthcare professionals. Now, if you've not heard about this already, I've already stated before that the UK has nearly 10,000 open vacancies within the NHS across all of its 4 countries, so that is England, Wales, Scotland, etc. But they believe that, obviously the UK MPs believe that if you stop overseas recruitment, this sort of vacancy gap is going to be even bigger in the next few months. Some other of the UK MPs feel that these changes are going to be discriminatory and unfair for all of the other people who are in the UK at the minute, or people who are looking to come into the UK in the future. Let's talk about what are some of the other reasons why the UK MPs feel that it is really important for them to stop or cancel the health and care worker visa. I think one of the biggest reasons why the UK MPs are suggesting this at the minute is because they believe and they feel really strongly that the UK can have all of its healthcare staff from within the UK borders themselves. So they feel that the homegrown healthcare employees are going to be much better and are going to be significantly in higher number as compared to the overseas recruitment. However, another reason they feel this is because they feel that if they redirect all of the funds that go into recruitment of international professionals or international healthcare professionals within the salary and the wages, the people who are already present in the UK will actually look up to take more of these health and social care jobs, which are right now being fulfilled by all of the overseas immigrants. However, what you do need to remember throughout this video is that all of these proposed changes and these discussions have not yet been implemented. They have been debated and are being discussed by the Home Office and by the UK government at the minute. And the UK government has still not officially put out a stand on what it really thinks it should go ahead with. So please be aware about this. And so I just want to say that in the meantime, all of the old rules are still applicable for the health and care worker visa. So if you are somebody who is planning to come on the health and care worker visa, all of the previous rules are still operational and applicable for you. Let's have a quick recap of what are some of the main criteria for the health and care worker visa. So the first major requirement is that you need to have an occupation within the health and care worker shortage occupation list at the minute. This is one of the biggest requirements for you to be eligible for the health and care worker visa. The second requirement is that you need to have a job offer from an employer who is allowed to sponsor your visa. Now, the NHS stands as the biggest sponsor for healthcare visas in the UK. So you ideally should have a job offer from somebody who's willing to sponsor your visa as a healthcare worker. You are required to meet the language requirements, that is your English language requirements, before you apply for this visa in the UK. The next requirement is that you need to meet all of the financial requirements. Now, these can be different based on if you come alone versus if you come with your wife or with your children. What you also need to remember is that under the previous rules that are still in place, you are allowed to bring your spouse and your children along with you. So you are allowed to sort of issue them with dependent visa when they make applications along with you as the main applicant. Hope this all makes sense, guys. And if you have any questions, leave them down in the comments below. Take care.